So our next speaker is Dr. Monica Rivera Mindt, who's a neuropsychologist and the president of the Hispanic Neuropsychological Society, a professor of psychology at Fordham University with a joint appointment at Mount Sinai. Thank you so much for being here with us today. And please tell us about your work and some of the exciting avenues that you're exploring to address health outcomes.
Wonderful. Thank you so much. Can you hear me okay?
Yes.
Okay, great. So first of all, I would like to note that I don't have any conflicts of interest to report. I also want to thank you and the organizers for having me here today. It's wonderful to be with you all. In terms of what I'll be briefly discussing today, I'll be briefly discussing brain health inequities as they relate to Alzheimer's and related dementias, or ADRDs, in Black and Latinx populations. Second, I'll be talking about sociocultural determinants of health and a framework to think about that. And third, I'll be discussing a culturally informed, community engaged research approach to increase the external validity of our work. In terms of brain health inequities, what we know is that Black and Latinx adults are up to twice as likely to develop Alzheimer's disease and related dementias compared to non-Latinx white adults. Not only that, but they are at greater risk to have a younger age of onset and greater severity of initial symptoms. And what really gets me about this is that by the year 2030, if current estimates prevail, Latinx and Black Americans will make up nearly 40% of the almost 8.5 million American families who are going to be affected by and living with Alzheimer's disease and related to dementias. And this is simply unacceptable. And as we try to understand brain health, Alzheimer's, and CNS disorders more broadly, a huge lacunae in the work over the last several decades, I would argue, is a lack of focus on a sociocultural determinants of health. I know there's a big focus more recently on social determinants of health, but I think we're really missing the boat if we're not also focusing on cultural factors, because they do account for significant variance in cognitive impairment and dementia. For instance, the work of our group and others, including Dr. Jennifer Manley, who's here today, suggests that lower quality of education, so not just years, but quality of education, acculturation, socioeconomic status as well, are all related to increased risk for cognitive impairment and in some cases dementia, as is a higher level of experience discrimination. Moreover, cultural heterogeneity is also an important factor that we need to think about. And basically what that means is not just looking at these pan-ethnic terms or groups, but really focusing on within groups, subpopulations. In our work, we have one study that suggests that Puerto Rican adults are at greater risk for cognitive impairment than Mexican-American adults. And that's why, again, it's really important to take this more sociocultural lens to our work, not just strictly looking at social determinants. We also need to be thinking about external validity and inclusion, because as we know, individuals from Black and Latinx populations are overrepresented in Alzheimer's disease and related dementias, but underrepresented in the research, which again is unacceptable. And to that end, there's been a wonderful systematic review by Dr. Andrea Gilmore-Vygotsky a couple years ago that showed that there is an evidence-based approach to increase the inclusion of diverse populations into Alzheimer's and dementia research, and that's community-engaged research. Basically, what that means is that every step in the research process, from study, question, to design, implementation, and even dissemination, we equitably include community partners in our work. And that's what we've done here in Harlem, and what I've done more recently on newer national multi-site studies. And we've been able to demonstrate that we can scale up these methods at the national scale to increase not only the internal validity of our work with utilization of sociocultural measures, but also the generalizability and external validity of our work by making them more inclusive and representative as we move forward. With that, I want to thank my collaborators and everyone who works with me on Salute, ADNI, BHR, Beyond, and all the other great studies that I work on. And I want to thank you for having me here today. Thank you so much.
Thank you so much, Dr. Rivera Mindt. And certainly you highlighted the importance of social cultural factors as well as heterogeneity, which I really do think are sort of, they do need to be considered a bit more in our studies moving forward and as we design interventions.